They're saying Clyde left the toilet seat up again.
Extreme toilet troubles, mascot misery, and what the heck is a human centipad? Today we are breaking down and reacting to some of the most cringeworthy medical scenes and absurd injuries from South Park. Let's dive right in.
What's going on? They're trying to save Clyde's mom. From what? They're saying Clyde left the toilet seat up again.
Just crack the porcelain, I guess. I mean, you gotta be careful of causing lacerations to somebody because when you actually break porcelain, it's like glass, so it can be super sharp.
When she fell into the toilet, she also made it flush. It created a suction that's literally pulling out her insides.
First thing I think of, obviously, is a rectal prolapse, and this actually does come into the emergency department. And what do I mean by a rectal prolapse? Your rectum, which is kind of the last bit of your large intestine before it becomes your anus and goes outward, flips the other direction and comes out, literally.
Literally?
Can't we disconnect the toilet from the plumbing? Yes, we'll have to, but when we do that, the change in pressure will rip out her organs.
Wow, interesting. Typically, your organs would not all come out of your anus because they're not all connected that way. Maybe they're describing it as a hole or a vacuum to suck everything out, but again, they're attached in all different places. We know this.
We notice.
Please, oh God, please, let me go, let me go. Do it, do it, do it.
Seriously? Seriously? Oh my gosh. What organs are in the abdominal cavity that you're worried about that are coming out? So besides your intestines, the large and small intestines, you're talking about the kidneys. You have your liver and you have your spleen, you have your stomach, you have your esophagus, you have your pancreas.
I'm here to announce a new product that will once again revolutionize the way we use our phones and tablet devices. Let's hear it for our volunteers.
Oh my God. It's interesting that their feet aren't actually strapped down. We have in the emergency department times when people do need restraints. And typically you do 4-point restraints. Sometimes you'll do 2-point restraints, but typically if you're restraining somebody, if you don't do all 4s, they will get out.
These 3 people have agreed to be brought here, handcuffed to these beds, and become the prototype of our first truly interface device.
We don't use handcuffs on patients in the emergency department for restraints. We do have people that come to our emergency department, especially if law enforcement brings a patient. From a medical standpoint, we do not use handcuffs, and oftentimes we ask them to have them removed.
Their lips will be removed, and they will be sewn together mouth to anus. You agreed to this, mouth to anus, so that the feces from the gastral tract from one will enter the mouth of the little boy, and he agreed this was okay.
We actually have a lot of medical issues that occur because fecal matter then being ingested and different disease processes that occur because of that.
I know, it's pretty gross.
Making a product that is part human and part centipede and part web browser and part emailing device. I give you the human centipad.
Oh my gosh, who comes up with this? Typically, the only time we ever use fecal material in a positive note is for fecal transplants when somebody has had their own digestive system so injured, the only way to recover from it is to put the gut microbiome of somebody else in there.
Looks good, guys. Great work.
Oh my God. Oh my gosh. That is totally inappropriate. I don't even know what I'm looking at.
What the hell am I looking at?
They're saying, oh, this individual said, okay, I'm okay with this procedure or whatnot. Majority of the time, it needs to be written down. There needs to be consent. But there are times when we will emergently do something without somebody's consent based on the fact that it's an emergency.
Chuck E. Cheese.
Who knows what Chuck E. Cheese is? Who likes Chuck E. Cheese?
Chuck E. Cheese.
Uh-oh.
Thanks for Marcus's birthday.
The first things that you think about due to the fact that the person is having difficulty with their stance and slurring their speech and coordination, alcohol use, you think stroke, you think hypoglycemia.
I'm hypoglycemic.
You think drugs, altered due to an infection. So a lot of different things can happen.
What's wrong with him?
Can't you tell he's high on painkillers?
Oh, there you go. Could be too.
Never meant to cause you any trouble.
Oh, man. Him vomiting, the things that we think about, reaction to the medications, and then aspirating. So do you actually end up inhaling your own vomit, which increases the risk of something called pneumonitis?
Percocet and Oxycontin found wrapped in his cheesecloth.
So Percocet and Oxycontin. So Percocet is acetaminophen, Tylenol, as well as oxycodone, and then Oxycontin is a longer acting version without the acetaminophen.
Prescription drugs, but with no prescription.
Prescription drugs in a vial that doesn't have a prescription on it. That's all you can tell from that situation. Could they be illegal substances or illegally obtained? Yes, because they are illegal substances, legal prescriptions, but they may not be obtained appropriately.
You guys know where all these illegal meds are coming from? Most likely from the prisons. Whenever there's a drug epidemic, you can usually trace it back to people who've been thrown away by society and forgotten about.
For many years, we've been having an opiate crisis where lots of opiates are coming into the country. When I used to work on the East Coast of the United States, there's a lot of heroin, pills like Percocet, Oxycontin. But now you're seeing, a lot of fentanyl, which is a lot scary because a very small amount of fentanyl can cause a lot of problems.
I understand that today they are performing Chuck E. Cheese's Autopsy.
Oh, the kid's party performer, yeah.
There are times that the medical examiner, we call the ME, will take the case, meaning they will perform an autopsy to figure out how the person actually died. But if it seems routine, if there doesn't seem to be any foul play, typically they do not.
As a concerned member of the public, I wish to be present.
Sorry, children aren't really allowed in autopsies.
Then I shall wait here to learn the coroner's findings.
They actually then will release the body to the family, but then at that point, the family could elect to have an autopsy or a medical examiner take a look at the body for an autopsy, but at their own expense, I believe.
Toxicology report shows subject had massive amounts of opioids in system at time of death. Now proceeding.
When we do a toxicology report or do a tox screen on an individual, typically in the emergency department for blood, we're looking at aspirin, Tylenol, and alcohol levels. And then in the urine drug screens, then we're looking for all the metabolites of different illegal substances. Yeah. Okay. To just cut off the mask. Some people cannot handle different scenarios, and thus one of the more common things is to vomit. You just don't want people passing out. That's the biggest thing. When they see blood, a lot of people get woozy and pass out.
We found nothing else except for 2 Hummels in the subject's rectal cavity.
Hummels.
His rectal cavities.
These little Hummels are figurines. Little things do go up the anus often. People come to the emergency departments that have accidentally fallen on them or lost them. It's okay. Some people use different things for different reasons, different strokes for different folks.
And you do not find this out of the ordinary?
Not at all. We found Hummels in nearly all the birthday entertainers' anal cavities. It's very common in our overdose victims.
The question is, are these figurines loaded with opiates and did it release? So we get concerned because I live in Southern California and near the border that we have individuals that come in as drug traffickers.
Excuse me, what are you doing here? If you want to be in the OR, a pass is required.
I don't know. I'm supposed to show these mountain lions how abortions are performed or something? I know, it's ridiculous.
What is an abortion in medical terms? In this aspect of it, it's the termination of a pregnancy. There are multiple reasons why this would occur, but these are typically elective abortions versus emergent abortions.
Well, you're in luck, I'm happy to inform. It's only 3 days until Christmas, so I have lots of abortions to perform.
Why is that a thing? Maybe because he's going on holiday or the hospital is not doing surgeries, so has to do a lot before holiday? Okay, so we're in the operating room. Obviously, this is not a sterile situation. The mask should be up. You would have somebody else helping you put your sterile gloves on, typically. It would be a very sterile situation.
This better have a point, dude. This really better have a point.
I mean, I feel the same way, man. Not sure why Stan is all bruised and bleeding. If it happens to be from the cats, then you get worried about cat scratch fever, right? Typically, there's specific bacteria relating to cat bites and scratches.
Dad, what the hell are you doing?
Oh, Dad doesn't look
Hello,
good.
Stan.
Dad, it's the middle of the day. I thought you weren't going to drink as much anymore.
No, Stan, you don't understand. I have a disease.
Typically, alcoholism relates to a disease of addiction. Stan's easily just saying, hey, just stop it. But it's really hard for an individual who is down this path.
Daddy's very sick.
What? Did you go to your AA meeting?
Yes, they're the ones that told me. I thought I could just quit drinking on my own, but it's an illness, son.
Stan's dad needs more intensive help to assist with his alcohol addiction. If you just are the occasional social drinker and you want to help protect your liver, I formulated a supplement that supports alcohol metabolism and hydration. You can find it at lifehappens.com or on Amazon.
I have to admit that I'm powerless to this terrible disease.
Dad, you've had enough. Just stop now.
I can't, I'm sick.
We do see a lot of individuals that come to the emergency department with a lot of different addictions, alcohol being one of them. You really shouldn't just what we call cold turkey it or just stop the use of alcohol, because you increase the risk of alcohol withdrawal seizures, delirium tremens.
Gotta try to take it easy from now on, son. Get Daddy another beer, will you?
No, you don't need another beer.
I know that!
Treatment for alcohol withdrawal typically is something called a benzodiazepine. First week or so, maybe a couple days shorter, a couple days longer, where you're in that withdrawal phase, and we want somebody to get over the shakiness, the anxiety.
Dad, you just need to not drink so much. It's very simple.
I wish it was that simple, son. But if I don't give myself up to a higher power, then this disease is gonna kill me dead. I'm afraid the only thing that will cure me is a miracle.
There are a lot of resources out there, especially here in the United States, hospitals, rehab centers. There is one misconception that people will come to the emergency department for detox, but we do not provide that because the compliance thereafter studied has been really low. We will give you all the resources, but the individual has to set it up for themselves. South Park, again, never fails to give us a lot of medical topics to talk about. If you guys have more clips you want me to check out, just send them my way. As always, please make sure that you check out this playlist right here, binge watch everything, and subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.